Hi everyone, thank you for joining me today. I'm Dr. Bita. I've been working at Center for New Medicine and Cancer Center for Healing. Today I'm going to talk about an exciting topic, quercetin. It's a powerful healing agent. It's a phytonutrient, plant chemical, which is found in a lot of vegetable and fruits like onion, red onion hires, cranberries, and red wine and green tea. And it's a powerful antioxidant. What that means is it goes after the free radicals, it helps with anti-aging, and it also helps with inflammation. It lowers our inflammation. It blocks the pro-inflammatory pathway like interleukin 8, tumor necrosis factor. So it's really beneficial for rheumatic arthritis. It helps with reducing pain. It helps with reducing swelling, and it helps with autoimmune diseases. It also reduces atherosclerosis, which means the hardening of blood vessels. So indirectly, it helps with hypertension. It brings your blood pressure down. It can help with lower blood sugar. It also helps with obesity. It helps with weight loss. And when patients who are obese, they tend to have fatty liver. It basically reverses the fatty liver. You do want to make sure, even when you have normal liver function tests, have an ultrasound of your liver yearly. That way you could see if you have a fatty liver, you could eat good vegetables, plant, good diet, becoming more vegan. When you have fatty liver, you could reverse it. And by bringing your inflammation down, you could also add some supplement like quercetin or milk thistle to help with your fatty liver. So, and it also quercetin have anti-cancer benefits. It has anti-proliferative effect. It basically stops the cell division. And it also blocks the p53 enzyme, which is always mutated in most of the cancer cases. There is a mutation in p53. What that means is cancer cells don't die. They don't go apoptosis. So it causes cancer cell death, which is great. And it's because it also affects the inflammation. As we know, when people tend to have inflammation and cancer, the cancer likes to metastasize and spread more. So it can block that. And they done studies in cervical cancer that it blocks the p53 and was able to reverse cervical cancer. It actually took us at the center almost 2 years to finally find the IV form of quercetin. So we have an IV quercetin now that we're starting using for our patients. So one issue is with oral quercetin, sometimes the bioavailability is not that high. You take, let's say you start eating a lot of red onions, a lot of cranberries, all that to elevate the quercetin, that's great. But one thing is the bioavailability. Your body is not absorbing it that much. So you need to sometimes adding vitamin C and adding other antioxidant like resveratrol and curcumin can help with the bioavailability, and also digestive enzyme like bromelain can help with the bioavailability. But for cancer cases and for other cases, it's like antiviral benefits, it's usually better to use the IV form. But also, like for example, I had a patient who had swelling of the lower legs, and I started her on quercetin, 500 milligrams twice a day, and her swelling of the legs went down. So in general, the best dose is you want to take it as a supplement dose for reducing your blood pressure and anti-cancer benefit and lower inflammation. You want to take 500 twice a day. It also have benefit in allergies, chronic rhinitis or sinusitis. If you get allergies, what it does is it stabilizes the mast cell. It reduces the histamine, so you will have less reaction. So it's a great anti-allergic, and you could take the pill form for the allergy purposes. And it's also have a bronchodilator effect. So people for asthma would benefit. People who's getting rashes, eczemas, they would benefit from it as well. And patients with COPD would benefit from it because it affects the lungs as well. It also have antiviral benefit. It blocks the viral proliferation. And in hepatitis C, they've done studies that it brought the hep C levels down. So overall, quercetin has a lot of benefit, and it doesn't really have much side effect. If you take really high dose, you may get a mild headache and you may get some GI symptoms. But other than that, I haven't had any patient with that dose I've been giving him complain of a side effect. And it's really not contraindicated. You could, everyone could use it except people who are on Coumadin and blood thinner, because it can affect it can thin your blood as well. So you don't want to use it when you're on Coumadin and blood thinner. But other than that, any kind of medication, any kind of supplement, it doesn't react. It's fine to add it to your daily supplement. So I think I covered it all. And overall, bottom line is it improves our exercise endurance as well. So for people who exercise, they could try that and see if they notice improvement. Thank you for joining me today.